All right, we'll start with putting your waist belt on. So the waist belt is the one that has the new Gait logo, and just put the new Gait logo facing up. Yep.
And the buckles should be 2 in the front?
Yes, please.
And snug, right?
Snug, yes. Just above your hips.
Okay.
Perfect. Now that shoulder harness that you held onto, if you want to grab that and orient it so that the clips that are going to hook in the top of the belt are facing down. Yes. Okay. Now put that right over your head so that the centerpiece lands in the middle of your back. And then just clip those right in the pieces that you have centered. Yes, exactly. And if you need to lengthen those chest straps, go ahead and lengthen those so you have more room.
Okay. And most people won't be putting this on themselves anyway, right? You're
They'll have someone helping them, yes.
Yeah, yeah. So this is not typical, to give a little bit of a credibility to this. This isn't how we would normally be doing it, but I'm not familiar with it, and you are in a different state.
Correct. Bring your shoulders up to your ears, kind of down and back, and then pull those snug, cross one right over top of the other.
Okay.
Just about there. Perfect.
Yeah, we have a thorough online training for our clinicians. Takes just about 45 minutes.
And I haven't been trained, just disclaimer, I've not been trained at all. So this is just a walk through, really.
Jay, go ahead and grab the proximal leg straps, and I want you to put them on just above your knees.
Okay.
Right above your patella.
And
so I want you to orient it so that the majority, so put that one on your left, see, that would be your right side.
Okay. Like this?
Correct.
Below or above?
Above, and actually move it so that that silver anchor is on the side. Yes, like that. Perfect.
Okay. Should I mirror that on the other side?
Yes, please. The other straps I want you to put below your knees, just about tibial tubercle level.
Do they have the
right or a left? No.
And the V goes up or down?
It goes in this direction.
Yeah.
Great questions.
Do these come in different sizes?
Yes, they absolutely come in extra small, small, medium, and large.
Okay.
And there's a chart that actually will help you choose what size that you need.
Okay. How does the clinician know, just from the dimensions?
Correct.
Does the clinician decide from the dimensions on the chart?
Along with that, our clinical model kit comes with all the various sizes that they would need. So they just.
So you're basically just testing everything at once. Okay. So now you gave me several varieties, but they would have gotten like the full gamut, right?
You have what they would get, the clinic model.
Okay, good. Yeah, I was gonna say, I have a lot of stuff. Mm-hmm. Okay.
So actually, as we're doing this, now I'm gonna actually have you take 2 yellow bands from the kit.
Okay.
And hook one end in the front at the top of your waist, at the bottom of your waist belt on the silver rings, and hook it to the front at the top on your thigh strap.
This one?
Yes, please.
Okay.
And do the same thing on the other side.
These aren't very hard to put on either if you have problems with finger dexterity, which is nice because you're going to have people that don't. Okay.
And then Jay, take two more and hook 2 more yellow bands. And I'm actually going to have you hook them to your most distal shoelaces, like grab like 2 or 3 shoelaces. And then stretch it up to the bottom of the V anchor. Yes.
Okay. Same on the other side?
Yes, please. And then can you describe what you feel?
I kind of feel like it's trying to pull me up with my feet, although it's not so much tension that I feel like I have to do it. I feel like it's kind of encouraging me. It's kind of like, hello, come on, come this way. I'm feeling it more from here, but I'm not sure. I think once I start to move, I'm going to feel it more from here. If I extend my trunk, I feel it more here. And again, I may not have it optimally because I'm not the clinician that's been trained in it yet. But I feel that it's encouraging me to bring my legs forward and my toes up.
Yes, exactly. Now we can also, use various configurations. You could just add ones to the side and actually widen your base.
Okay.
You could put extension. I mean, there's lots of things that we could do, but overall, this is a configuration to start with.
Okay. Now your thought process is based on your evaluation and the weaknesses that you see?
Absolutely, yes.
Okay. And when you deal with somebody with tone, how do you overcome that? Or is that not even an issue?
No, it is something that you can overcome. You absolutely need to work with the person to figure out what actually breaks their tone. Sometimes it is the strength of the band. Sometimes it's the placement of the band. Sometimes it's using resistive force. So it just depends on the person. So you kind of have to experiment and listen to what they're telling you. One of the adult CP patients that I recently worked with loves putting the new Gait on because it breaks her tone and she can sit naturally. You can see her video on our website. It's a great video and she just kind of describes what it feels like to have that tone release.
My tone is centered around my hips and it's very tight and my legs seem to always want to go together. And I put the new Gait on and it was amazing because the tone just disappeared because it held my hip in a position that my tone doesn't let it go to. So once we found the right band and the right strength, when I stood up, the tone was gone. And
okay, so it's not just necessarily for movement. It could also be used for just simply being able to be in one place comfortably.
Absolutely, yes.
And posture as well. Do you feel encouraged to stand taller?
I feel like to counteract it. So I feel like it kind of say, okay, you can go like this, but I feel like if I try to stand tall, then I'm getting for sure more of the pull here.
So you're getting feedback.
When I start to walk, it kind of wants to take me that way anyway. So I would imagine that part of the cueing of the clinician is continue to use good posture so that you initiate more of this. Is that correct?
Absolutely.
It feels neat. I told you, it's comfortable. It's not uncomfortable at all. And yet it's subtle in the kind of like the tactile cueing that we would give.
Mm-hmm.
You know, the little bit of the here, there, which is neat. So there's different colors to these too, right?
Yes, so you have the least resistance on right now, but there are also red bands and green bands that you could change to. Let's say you needed a little bit more hip flexion. You could actually just switch those out. And frequently what we'll do is start with yellow, and as they start walking and you go, ooh, they need a little bit more on the right side, we'll transfer just the red band on the right side and actually build this to their need.
Okay.
The other really cool thing is that as you work with them, you realize that, ooh, that's gotten stronger, but they could use something, maybe a little more dorsiflexion on one side, or maybe a little bit of abduction. So you can just have this grow with them as they get stronger to help facilitate other muscles.
Documentation wise, is that clinically evidenced difference where you're going from one color to the other, or would they want something in a muscle grade, or would that be something that they would accept as improvement?
Well, you probably have a better clue than I on that, but I would say absolutely, you can visually see it in their timing. You can see it in their step width. So it is measurable standard, yes, that maybe not necessarily measurable because you switched in color, but you could actually use other parameters to actually justify it. So absolutely.
And then the clinician uses this. So it's really not a big deal for the client to try it, right?
Correct. Correct.
So it's kind of like test it out, see if you like the card before you get going.
Absolutely.
Okay. So you wanted to do the dorsiflexion and the, I guess, hip flexion coming forward. Is that what you see the most of people having problems with, is just, coming forward, or is this just a good start place?
It's just a great starting place. I would say probably the number one thing that we see is dorsiflexion assist is needed. It's amazing how many people need that toe lifted up to actually improve their strides. Mm-hmm. And then overall posture, if you absolutely fix their posture, you solve many, many gait deviations. So just putting it on in general and doing the configuration you have on right now with possibly abductors on the side, so from the waist belt to the side. Yeah, that is actually the probably the most standard configuration, and it gives the best feedback, just general feedback, to help people stand up taller and have an improvement in their gait.
My mind goes to like so many different ways that you could use this that I'm sure you've thought of, but you haven't shared. Parkinson's patients freeze. So part of the problem with the freezing is they fall, right? Mm-hmm. So I wonder if the impetus to continue going forward, because sometimes I'll just take the walker and kind of pull it a little bit. Mm-hmm. This is kind of what this is doing a little bit. You haven't worked enough with them to give a comment on them, or have you?
I have not worked enough with them to give a comment. What I do know is that it gives enough feedback through the body that the gentleman, I've only worked with one gentleman, and his freezing went away. We didn't have the freezing because he had the proprioceptive feedback through his body from the harnessing.
Oh, okay. So yeah, let me show you. So it sits very comfortably. It's not tight. I have it snug. Mm-hmm. But my hip bones kind of keep it from going down lower. I guess for a guy, you may have to tighten them up a little bit more. But it doesn't feel uncomfortable to stay here. I feel like I'm working a little. I don't feel like I feel like, now I don't know if it's because I'm neurotypical or what, but I feel like, okay, stand straight. I do feel that I'm doing a little work, but I don't feel overwhelmed.
And that is something that we do warn people, is that you are doing work and that you're doing more work than you realize. So when you take it off, you may be a little sore, just like if you did some exercises and then the next day you have a little bit of tenderness in your muscles. And it just depends on, where they need the assistance or where they need the resistance. I mean, you could connect those together and literally hook one from your toes all the way to your waist. If you have, let's say you needed something to cross both joints and help with initiating flexion, knee flexion, you could twist it around because you have an internal rotation. So there's lots and lots. You're right. There's tons. The sky's the limit for configuration.
So it's like an erector set. You kind of figure out what you need on the basis of the person.
Exactly.
With people with sensory issues, people that get overloaded really fast, does the constant pressure help that they're at least, or do you find that it's a problem for them?
It depends on the person. I've had it both ways. I've had it where they feel overloaded, so you do just one thing at a time. So maybe you'll just put the dorsiflexors on and that's all you do for the first session. The second session, you might just put the waist belt and the thigh pieces on and just give them the feedback there. And maybe by the third session, you can now put the whole system on, but it does take time for sensory issues.
A lot of the neuro of the friends of mine do kids. I do one, most of mine are adults, but the kid that I have doesn't have the cognition to know, okay, this is what I'm supposed to do. It's not translating, but this would give him the nonverbal cue, correct?
Absolutely.
Okay.
I'm working with a young person who has KIF. They don't have the pathways to know what is their body's doing. And so this has worked really well to create new neural pathways for her, which I think that's similar to what you're talking about.
Mm-hmm. Yeah, and then that aphasic person that doesn't have a clue what you're saying, you wouldn't have to, because this is a little bit more primal than words, right?
Yes. And now you have your hands free to use them in a different way, to cue them differently and help work through those complications. Yes.
Have you used it on the upper extremities?
Yes. If you notice, the piece in the back has holes in it.
Yes.
So up top where it crosses, you could actually use the leg straps on the arms, because we call them limb straps, so that you could actually help with trunk rotation. You could help with elbow extension and flexion. There are ways to actually extend the wrists. So you absolutely can use it on any part of the body that you can connect to. We've actually used it up to help with the head, so that they could learn how to bring their head back up. Obviously, you use a gentle pressure on that. You're not going to like reef on it, but just having
people that just for training posture, I think it would be neat. Like this way and this way, like if you're C-curved or something.
Trunk extension, the ones, the people that you have with forward trunk lean to help extend them. Trendelenburg, you can actually put it on the side so that you
were
pull
saying to
the opposite side, so that they actually don't have the lateral trunk bending, and that muscle actually fires. So again, the sky's the limit. If you can think of it, you can do it.
How did this begin? This started with a spinal cord patient?
So going back to the very beginning, Banga and I were both track athletes, and we originally had the idea to build a device, a wearable harness, to help athletes sprint faster. So the original idea was that the bands on the anterior thigh there, that they would actually resist glute and ham activity as opposed to assisting with hip flexion. So you could wear it while sprinting to strengthen those muscles, which are found to be most dominant in sprint performance. So that was how we originally built this harness. And then, Kim Spranger, a coworker, a colleague of Lynn's, first saw the device and thought to use it on a young patient that had a spinal cord injury. Emily was told she was never going to run again. And I think about 3 months down the line, she began to run with the device on.
And she's in the video online that you can see. She's one of the videos that you can see.
They said I was never going to run, and I'm running. And it's just, it's I don't know if it's confidence and it's everything. Like, just, it gave me so much of everything.
So I love this device. I don't want to give it back. I can really see it being used when you don't have as many hands as you need, even. Because when you treat a patient, sometimes you just don't have enough hands, and where you have to stabilize one place and you're trying to facilitate another, and you're trying to get back far enough that you can actually see it. And there's just not enough hands for all that, where this kind of takes the place, which is kind of nice.
Exactly.
Well, kudos. This is the item of the year for me.
Oh.
I have seen many products. I have not seen anything as cool as this. This just seems so versatile. Orthopedic, neurologic, pain. You talked about pain earlier in one of the clients, that just the fact that they don't have to trigger their muscles as much, they don't have to fatigue as much, probably with COPD and heart failure. You can facilitate that the workload is less, right? I just see it to be such a great device.
Yeah, you mentioned the big three: orthopedic, neuro, and pain. And we're still learning every day. Trying it on new things. But thank you for the great words.
You did it. I'm just getting the chance to show it off. It looks great.
We appreciate that, Jay.
Yeah.